Good evening, everyone, and welcome to today's webinar titled The Nexus of Work Culture and Mental Health. My name is Dr. Michelle Kagotho, and we'll give 5 minutes to allow more people to join in, and then I'll introduce our speaker for today. Karibu sana. All right, then I think we'll just go ahead because I can see the numbers are growing and we have a forum. So good evening, everyone. My name is Michelle Kagotho and I am a general practitioner. I'm also a member of the KME Physician Wellbeing Committee. And I would like to introduce today's speaker. Her name is Dr. Irene Machua, who is a consultant psychiatrist at the Kenyatta National Hospital and she graduated from the University of Nairobi. She's also the medical director and the consultant psychiatrist at LifeBridge Psychiatric Hospital, where she leads a multidisciplinary team in management of psychiatric disorders. So she also has an interest in teaching, and she also works as a part-time lecturer at the KMTC teaching the Pioneer. She worked as a part-time lecturer at the KMTC teaching Pioneer Clinical Officer students in 2016. In addition to that, she's also a member of the National Executive Council of the Kenya Psychiatric Association in charge of welfare and wellness of all psychiatrists. And she also liaising with the KMA on physician wellness program, among other duties. She has a vast experience in management of psychiatric disorders in children, adolescents, adults, and the elderly, as well as those with substance use disorder. She's passionate about creating awareness of mental illnesses as a prevention and as a way of reduction of stigma to affected patients. So, Dr. Irene Machua, karibu sana. We are very excited to hear what you have to tell us about the nexus of mental health and work culture. Karibu sana daktari.
Good evening.
Good evening.
So just a minute, let me share. Sorry, let me share my slides so that I can, are you able to see it?
Just a moment. Not yet. Yes, it's starting. Yes. We can see your screen, daktari.
Okay. So good evening, everyone. My name is Dr. Mashua Irene, as you have been told. And today we are doing the nexus of work culture and mental health, which is a topic that I found very interesting. And when I was told to present on the nexus, believe you me, I was wondering what nexus meant, just like everyone else is asking what is nexus. So to cut the story short, nexus is a connection, and we're looking at the connection or the linkage between work culture and mental health. So as you look at that picture there, we're looking at employees at the workplace who are very happy, they're excited, they're linking, they're talking, they're discussing, and very happy, and which means they're healthy mentally. It can lead to being healthy mentally. So my name is Dr. Mashua, and I'm a psychiatrist at the Kenyatta National Hospital. So what is culture? Because you can see we are discussing about work culture and what is now culture. So a culture cannot be precisely defined because it deals with the state of mind, the feelings, the perceptions, the values, the beliefs, the attitudes and assumptions, which generally are intangible. And therefore, culture can manifest itself at times through dressing, the foods that we eat. As you know, when you talk about the Luo culture, the Kalenjin culture, whichever culture we're talking about, it can manifest itself through dressing, food, dance, language, the norms, the beliefs that people believe in, and the practices generally. If it is circumcision, if it rites, that's generally what we think about. So a culture, through shared social values on what is right, good, true, and desirable, and most of all, important in life is the norms of behavior. And these are unwritten rules of conduct that are passed by words of mouth and forced through reactions of people. So it is a customary way of doing things, that this is how we do our things. So it's an accepted way of behavior or way of life, especially the general customs and beliefs of a particular people at a particular time, because it can change with time. So therefore, we are learning that culture is learned, it can be shared, it evolves with time, it is transmitted from a generation to a generation. It determines how people of a society think, how they feel. It directs actions and defines a person's outlook to life, generally how you behave, the behavior. And cultures can be emotional, especially when change is threatened, because people are now used to it. And when you know they feel it's changing, people become emotional. So what is work culture? So a company's culture is its personality. And it tells its employees how to do their work. So it takes signals from leaders and underlies motivation, morale, and creativity. So this is how we do our things at our workplace. So personality can include how people communicate, the attitudes of the employees and the employers, their behavior, how they present themselves, how they dress. So this is generally now what we call work culture. So an organizational culture, work culture, it means the way things are generally done here. So at our facility, at our place, this is how we do things. So the way things are generally done here. So the culture of an organization evolves over time, and employees may be aware, may not be even aware that it exists. So it can evolve within time. It can be, as I said, a culture can change from time to time. So employees may not even be aware that an organizational culture exists. And a culture can be either positive or negative. And you're talking about a positive culture, and a positive culture is an asset to an organization. The opposite is true. A negative organizational culture is a liability to any organization. So within an organization, we also find some people have subcultures, culture and subcultures. And once organizational culture has been formed, it takes time and real effort to change. This is how we've done our things. This is how we communicate. This is how we do our things. And any time somebody tries to change something, people become emotional, and it really affects most people, especially because you're used to how things are done. So aspects of culture, we are talking about two critical aspects of organizational culture, and it influences how the way work is done and how the way people relate in an organization. So in an organization, this is how our work is done. This is how we relate, either positively or negatively. And remember, I've told you positive is an asset, and negative organizational culture is a liability to any institution. So how is an organizational culture evolving and how is it transmitted? So we could have values of management. Any institution has a management, maybe a CEO, or director, or a board of management. So the values of our management can affect the organizational culture. The vision, the mission, the motto of any institution, and I believe most institutions have, what do they want to achieve? What is their mission and vision of that organization? There's also some informal groups that are formed in institutions, groups that are not really formal, but small divisions of groups that can affect a culture in an organization. Socialization, ceremonies and rites of a place, stories and languages of how beautiful a place is or how not good it is can affect an organizational culture. So for example, I took where I work at Kenyatta National Hospital. Our motto is we listen and we care. So the institution works towards listening and caring of our patients, the employees. So any place has their vision and mission. So this is just an example of it, what you can do and grow towards it, bringing in levels of organizational culture. So we are talking about an invisible level and a visible level. Remember, I told you culture cannot be seen. At times sometimes it just felt, but you cannot see. So invisible levels includes the values and the beliefs, and they persist over time and are very resistant to change. But the visible ones is now what you see, the awards, the dresses, those visible and tangible aspects of culture that one can feel, they can hear or see on entering any organization. Like, for example, when you get to a facility or a department, the tone of the employees, the language they use, is it a polite language? Is it impolite? How do they welcome you? The manner of dressing, are they dressed appropriately? The style of addressing others during meetings, how do they address each and every person? Welcome given to visitors. So these are the visible kind of levels that we see in an organization. What we see now, the visible ones. The invisible ones are the values and beliefs that people are not able to see. So observing a culture, by observing the way people act in a work environment, can easily tell you how the culture is constructed. For example, if people are motivated and engaged, definitely it tells you the nature of the culture, of the company's culture. The opposite is true. If the employees are defensive, they're irresponsible, they're passive, you'll also understand the company's culture. So you're looking at a professional and unprofessional work culture. You're looking at the good culture, the positive culture, the negative culture, the assets, the liability of an institution. So what factors encourage a negative culture? We're looking at the weaknesses and loopholes in the systems, biased reward and punishment systems, that there's some people are rewarded this, others are not this. Some people are punished because of this, a small issue, others are not. At times you can have unnecessary competition, or especially when an individual interests overrides that of an institution, it can lead to a negative culture. Also, where the prevailing perceptions and attitudes are unfavorable, the attitudes in the place, the attitudes of the employees, their perceptions, they're not favorable. Or their lack of clear policies and procedures of how things are done. Remember, I've told you work culture is how our things are done. This is how it is done, a personality of an organization. If there's a lack of a role model, it can also lead to a negative culture. Failure to enforce the prescribed rules and regulations, that there is no leader to enforce such kind of rules and regulations, can also encourage a negative work culture. So negative work culture is a liability, it is undesirable, because at times you can have things like bribes, people are corrupt, they're taking bribes, they're corrupt people, revolutionary, they oppose the status quo, the kind of dressing is not desirable, there's a declining work production, people are late, some people are absent, some people are favored over others, there's tribalism, there's a delay in accomplishing set programs. We have biased promotions. Others are promoted on time, others are not. There's gossip and people are idle because of less workload. Leakage of confidential information, which is not supposed to. There are lack of set procedures, that there are no rules and regulations in a facility. Poor communication of official information, and information has to be passed. It is poorly communicated to the employees. There's unethical behavior. We have false claims and misuse, interesting misuse of water, power, stationery, and telephone. That's an interesting one that can lead to a negative work culture. So a positive organizational culture is now an asset. Remember, the other one is a liability. This is now an asset. In a positive culture, people know what is expected of them. You know your roles, they're clear. This is what you're supposed to do. They waste very little time in deciding what to do because they're empowered. They know how to act in a given situation. That even though you're a junior or a senior in an institution, you know what is expected of you. And therefore, when a challenge comes, you automatically know what to do. A positive culture enables people to feel better about what they do. You feel you're accomplishing, this is what I trained for, this is my skills are now being used into place. They feel much better. It also conveys a sense of identity for organizational members and unity of purpose. You identify to a place. And a positive culture positively influences employees' way of life. So you're positively impacting on the employees. They feel good. They know what they're supposed to do. Anytime a challenge comes, they just automatically carry it on. So this is a positive organizational culture. So when you look at differences between the professional culture, which is the positive one, and the unprofessional culture, in the professional culture, people enjoy working together. Remember the picture I showed you, the first one? They enjoy working together. They're laughing. They're cooperating. Employees and managers are willing to help whenever needed. You're just excited about doing something. Customers report high marks for service. They just feel the service is good, the delivery was good, the people they're talking to us very well, there's good customer service. So you're always getting positive feedback on what you do. Problems and issues are discussed openly. We have an issue in the institution, we have this. Let us know what we can do as a group. What can we do? Put our minds together. And when something doesn't work, the focus is on identifying issues and not blaming anyone. That this is a challenge that has come out. What can we do? What have we learned on this? Let us do a postmortem of the issues that have come up. How best could we have handled such a situation? And that is a professional culture. The opposite is true. People form cliques and they gossip in an unprofessional culture. They resist change or undermine anything. Anytime you introduce something, there's resistance. And employees and managers stick to, it is not my job. This is not my work. I'm not supposed to do it. Customers are always complaining about the service because the employees are not happy. So therefore, the customers will not be happy because the services offered will not be good. So problems are not discussed, even though everyone knows about them. The problem has been brought out. We know this is what has happened, or there's a change in it, but people are not discussing. Like, remember this one, the professional one, they were discussing it openly. But this one, they're hiding it. Nobody wants to talk or open up on anything. And when something doesn't work, there's always blame game. This is what happened. The person should have done this. The leader should have done this. They should have done this. This is not professional. But remember the other one, they don't blame. They look at how best could we have handled the situation. So building a positive work culture means there's a purpose driven. They help employees find meaning and purpose. There's respect. They treat employees and colleagues with respect at all times, that every employee matters. Respect is supposed to be given to each and every individual. There's action focus. They lead by example and actively participate in problem solving. Everyone comes on board. What can we do? How can we do it? How best could we have done it? They empower, they trust employees and provide autonomy. That an employee should not always go back to the employer. What can I do? How can I do best? Remember the other one we said they waste less time in providing solutions. So because they have been empowered, they know what to do. There's forgiving, avoid blaming and instead focus on coaching. Prioritizing, communicate organizational priorities openly. This is what you're supposed to do as an organization. This is what we can do at this time. This is what you can do at a later date. So they prioritize what is supposed to be done. There is empathy. They focus on problem solving instead of blaming individuals. There's a listen. Remember Kenyatta, we listen, we care. So they give employees a platform to share ideas and concerns that you are worthy, you're supposed to be listened to, you are supposed to be respected. Patience. There's building a positive work culture. It takes time and there's patience. People are patient with one another. And when anybody does something good, they celebrate, they clap, they enjoy the success of an individual. Not always, people should not always look for a downfall of an employee, but anytime there's something beautiful, celebrate. So this is like a summary of how to build a positive work culture. Purpose-driven, respect, action focus, empower, forgive one another, prioritize what is supposed to be done. There's empathy, listening, be very patient, and celebrate when there's a success. So the key areas to focus for better work atmosphere. One is leadership. We're looking at a leader, what a leader is supposed to do. We're looking at the communication skills and how to better make a work environment to be the professional work culture that you're talking about. Looking at the staffing, the number of the workload. Looking at any compensation. Are there compensations of things that are done? We'll look at them one by one. And recognizing somebody they have done well, celebrate for that, and we are happy for your success. So look at this leadership effectiveness. This is a leader giving, what can we do? This is the priorities. We need to do this. Giving like a solution, and we're discussing as a team, what can we do? So distinct leadership styles are practiced. The leaders are always available and approachable. The key thing is approachable. Be a leader. If you're in a leadership role, be approachable. That anytime somebody has an issue, they can come to you as a first person. What can I do? I have this issue. How can you best help me? Or I'm going through a challenge at my workplace. I'm going through a challenge at my home. Please help me or advise me. So be approachable. Have a clear vision that is communicated and shared. We say the vision, the mission, the motto of an institution. This is what we can do. Be a coach. Have a good work-life balance. Remember, we are also parents. We have hobbies. We can do other things apart from work. Remember, work is just forms a part of us. So we have relationships, we have families, we have hobbies, we have talents that we can grow. Let's especially nurture them. So having a good work-life balance. Also, encourage people to have career development or skills development. That if there are seminars to be done, to be attended, there are conferences, encourage people to train, be better individuals in their different places of work. So one of the key things for a better place or a better work culture, professional culture, is leadership effectiveness. The second one is voice or communication. This is a team we are discussing, is a two-way communication. What can we do? Let us plan on this. Encourage somebody, be there for somebody. They're willing to share both good and bad news. And an employee advisory groups are existing in place. And HR is the human resource manager is perceived to be employee advocate and not the employer advocate. Be an employee advocate. Listen to the employees also. Talk to them, guide them. And when they have to take their leaves, what can we do? Or they have issues with staffing, be somebody to listen to. A two-way communication. You talk, I talk, we talk, the other way around. So the third one, we've talked about leadership. We've talked about leadership, voice of communication. The third one is staffing and workload. Look at this person here. He's carrying a lot of, it's too heavy for him. So obviously, if there's excessive workload, somebody will not deliver. So quality drives staffing decisions. We look at resources and technology support, selection based on behavioral fit, that somebody has been selected based on how they are, and solid focus is on learning and development. So the staffing should be appropriate. What they trained for is what they're trying to do. What they trained for is what they're doing. Decrease the workload so that they're able to have effective workload management, so that they're able to deliver it on time and deliver it the best way they know how. So the fourth one is compensation practices. Give them market competitive pay practices, that you pay them according to how the market dictates. Flexibility, if they're going beyond time, reward them. Understanding of total compensation and fair and equitable rewards. If it's time to be rewarded, reward them. And the fifth one is recognition. Look at this lady, somebody's congratulating her. Or, I mean, the employees are congratulating her. You have done well. Recognize. Recognition and appreciation occurs formally and informally at all levels. Not must you get a trophy, you get this, but when somebody just says, you have done well, somebody's proud that they have done extremely well, or they're being encouraged, somebody's seeing something good in them. Make employees feel valued. Reinforce linkages between the employee performance and organizational goals. What are the goals of the institution? What do you want to achieve? And improve employee motivation and satisfaction. Let them be satisfied with what they're doing. Let them be motivated. Recognize them at every other angle, whether formally or informally. So we have talked about work culture, what we can do, the things we can do, and as a summary, this was what we look at: the key areas to motivate, to focus for a better work atmosphere, the leadership, voice or communication skills, the staffing and workload, compensation, recognize them, and work culture, recognition and culture. So remember the topic we were discussing was the nexus or the linkage between work culture and mental health. So what is mental health? So according to WHO, World Health Organization, they defined mental health as a state of well-being in which an individual realizes his or her own abilities. This is what I can do. This is what I'm best in. They can cope with the normal stresses of life. That anytime there's a change in life, change in things, in the way we do things, you're able to cope with whatever comes through. And the key word is they can work productively, meaning WHO and mental health, WHO has recognized that for you to be healthy mentally, you must be able to work productively. So key thing is work productively. And also be able to make a contribution to his or her community. For example, if you're a father, a mother, a sister, a leader, whichever role you have in the society, you're able to contribute effectively. And that is being healthy mentally. So mental well-being is a number of things put together. We have individual confidence and self-esteem. We have relationships and emotional support. We have work satisfaction and achievement. So they're interacting together to get something called, or to form something called the mental well-being and resilience. That how your confidence and your self-esteem interacting with the relationships, or you supported emotionally, to you having or you have job satisfaction, your achievements at your workplace, or whatever achievements you have, all these are interacting to now have mental well-being. That is about how feeling positive about ourselves, either as an individual, our work, and our relationships, all interacting. And for most people, finding a good balance in our lives help to sustain our well-being, and it is part of our identity. So building resilience involves identifying our strengths and capacity, using this to deal with setbacks in life, and adapting to change and facing adversity. Remember, mental health is being able to be able to cope with the stresses of life. So you're trying to build resilience. So guidelines for mental health at the workplace. We have the first one, this one. is a guideline by the Ministry of Health that was released in September 2023. It's called National Guidelines on Workplace Mental Wellness, and advise each and every person to download this and get it and read and go through. As a leader, as an employee, what can you do to achieve mental wellness at the workplace? This is a good guideline. It gives you what you can do as a leader, as an employee, some of the forms or assessment tools that can be used to assess when somebody is not healthy mentally, be it be depression, be it be anxiety, bipolar mood disorder, substance use disorder. So it's a good booklet or a good document that can assist. We also have the WHO guidelines on mental health at work. This was released a bit earlier, 2022, and it guides us on how best we can achieve and encourage mental wellness at the workplace. So we have global and regional statistics. This according to that WHO, and this is 2022. That was when the book was released. They said about 55.8%. This is almost half of the global population is working. And remember, we are looking at workplace, mental health at the workplace. So we're looking at almost half of the population is working. And estimated about 15% of this working population is living with at least one mental health condition. Very big number. 15% of the 55.8% of the global population. And 12 billion working days are lost every year because of depression and anxiety alone. Meaning we are losing so many days because remember the other mental health conditions. We have over 330 mental health conditions. So we are losing so many days, working days, as a result of mental health. So it is time to take charge. So depression and anxiety cost the global economy approximately $1 trillion each year because of reduced productivity. Remember, we are losing so many days, there's productivity that is being reduced. So we are losing money at the end of the day. And in Kenya, the statistics were that about 24.9 million people are working, almost half, and it translates approximately 15% or almost 24.9 million people. The 3.7 million Kenyans are living with mental health conditions, quite a big number. And the most common mental health conditions that we see are anxiety, depression, substance use disorder, and substance use could include alcohol use, marijuana use, miraa, muguka, whatever substance, name them. We also have another common mental health condition, schizophrenia, bipolar mood disorder. So among others, these are just the most common mental health conditions that were identified. So this was it was the newspaper. Someone shared it that as a result of there's a World Mental Health Day that we celebrated on 10th October. This was last week on Thursday, and the Health Cabinet CS, Dr. Deborah Baraza, gave a report and celebrated it. It was celebrated at the Mathare National Teaching and Referral Hospital. It is a day celebrated worldwide to celebrate mental health. And this year, fortunately, the theme was, it is time to prioritize mental health at the workplace. So she was giving figures of the number of people who have mental illness at the workplace, and it was therefore encouraging people that it is time to incorporate mental wellness at the workplace. Remember, this is where we spend most of our time. We get in at 8, some people get in at 5, other people have night duty. So we need to be healthy mentally at the workplace. So without effective support, mental disorders and other mental health conditions can affect a person's confidence and identity at work, capacity to work productively, several absences, and the ease to retain or gain work. Therefore, we need to be supported at the workplace because it gains this confidence. You identify with the place, you have capacity to work productively. We have now more people attending work, less absences. Remember, we are losing a lot of money, and ease to retain or gain work. So people living with severe mental health conditions are largely excluded from work, despite this being important for recovery. And therefore, it means the patients who go through, like, for example, schizophrenia or bipolar mood disorder, they're really excluded from workplace because people feel they cannot work. And therefore, because they feel they're excluded, and this would be something good for them for their recovery. It would be important for their recovery to be incorporated back. So we are asking them that even patients or workers with mental health challenges, let us encourage them to work and be incorporated at the workplace. So a decent work supports good mental health by providing a livelihood. When you have a good workplace or you have a good work, a decent work, it is a source of livelihood. There's a sense of confidence, purpose, and achievement. It is an opportunity for positive relationships and inclusion in a community, and it is a platform for structured routines among many other benefits. So being at work is quite good. We're looking at some of the positive things of working. And a safe and healthy working environment is a fundamental right. It minimizes tension and conflicts at work, and it improves staff retention, work performance, and productivity. So what you're saying is we need a safe and healthy working environment to the employees and the employers as well. But for the employees, we need them because we need them to work well, to minimize tension, to reduce conflicts. We need more of them to be there to reduce absenteeism at the workplace. So lack of effective structures and support affects a person's ability to enjoy their work and do their job well. And it can undermine people's attendance at work or even stop people from getting a job in the workplace. So we need effective structures. We need to support people. We need them to enjoy. Let it be a place where we can enjoy. When you're waking up in the morning to go to your workplace, you want to enjoy, you want to spend, this is where you spend most of your time. You want to feel good, feel loved, and have a good and healthy relationships at the workplace. So we're looking at the interplay, now the nexus, the linkage between mental health and work. That one of the key things as a social determinant of mental health is work. What do I mean by that? That a meaningful work is protective of mental health and it contributes to a sense of accomplishment. You're getting money is a source of income, there's financial independence, there's confidence. For the mentally ill, there's recovery and inclusion of persons living with mental health conditions. So a meaningful work is protective, and a harmful or negative work environment can significantly contribute to physical and mental health problems, harmful use of substances, and even make the existing mental health conditions worse. That if you have a negative work environment, it can make you get stressed, you feel you don't want to work, or it can push you to start using substances and alcohol and other substances. So we are saying let us have a meaningful workplace where we feel good, we feel we're accomplishing our things. This is what you trained for. This is somebody who's encouraging you. Somebody is looking at the positive side of you. You're spending your time there. There's financial independence. So what you're looking at is meaningful work. So professional workplace culture includes healthy work relationships. There's increased productivity, there's a sense of safety and well-being. So how is it helpful to have a good workplace culture? It reduces stress, it promotes better teamwork. You're there, you work together, you feel satisfied, there's less stress, you feel good. Automatically, you just feel good working there. I feel good working at an institution. I feel good working at this department. And there's less and less of stress. So people with severe mental illness are more likely to be excluded from employment because we've had most cases of patients who have mental illness, most of them are not working. And when in employment, they're likely to experience inequality. Most of them will think because this person always has depression or is always breaking down or has alcohol use disorder, is always drunk, oh, this person, we don't want them. So they feel challenged, they feel discriminated. So being out of work also poses a risk to mental health. Unemployment, job and financial insecurity, and recent job loss, they're risk factors for suicide attempts. So we are saying being at a workplace, having a job, financial independence is key to reducing mental health. So we are saying employment is quite important. And I'm sure most of the people who are employed or who were unemployed before, they felt like everything was black or dark in their lives. And when somebody got a job, it was like things were opening up. So we need that place when we felt things were opening up. We want to encourage people that let it be a place where you feel good, you feel loved, you feel encouraged. So what are some of the risks to mental health at work? Workload. If you have too much workload, you're giving somebody too much work, it can cause them to have a poor work-life balance. If you're working too much, you're working from 8 to 8, working in the evening, you're carrying your work at your place, you'll have less time for your family. You have less time to work on your talents, to work on your hobbies. So you're always stressed. And eventually, because of too much workload, it will lead to low productivity. So don't think because you're working too much, it's good for you that you'll feel somebody will say you're doing well. No, at the end of the day, it will affect you because there'll be a higher stress level and low productivity. Insufficient work can also result in lack of satisfaction. You can imagine going to work 8 to 5, you've not been assigned any job. Your work is just to sit, wait for lunch, go for lunch break, come back. Nothing satisfying about the job. So this can also lead to mental illness. So poor interpersonal relationships. If you have unsupportive supervision, poor relationship with colleagues, you feel bullied, somebody is always on your neck, you're not doing this, you are not worthy, somebody is harassing you, and harassment can be physical, can be sexual, violence. So these poor interpersonal relationships with colleagues can affect or can lead to some of the mental illnesses at the workplace or unprofessional work culture. Also, we are looking at the workplace culture. Remember, when we talk about the definition of workplace culture, this is how we do our things, the personality of an institution. And it can involve poor communication, poor leadership. If you have poor communication, poor leadership, poor clarity about the workplace objectives and structure, the employees will not feel motivated. They'll always feel this is not a place to work. They'll always feel discouraged, resulting to stresses, depression, anxiety. So a poor company culture may not inspire employees to be more productive and positive at work. And in turn, there'll always be a turnover. You'll always be hiring, firing, because there's no job satisfaction. Another risk to mental health as a continuation, 5, is insufficient skills for the job. Skill gap have the potential to harm an organization's productivity, as worker productivity is likely to be lower and result in stress because of non-performance. But if you're hired for the job or for the thing that you trained in, you'll always feel good. You'll always feel like this is what I trained. You have done maybe medicine and you're posted to do things to do with IT. And maybe this is not what you want. Maybe just been placed there for a short while. You're not satisfied with the workplace. Lack of proper resources or equipment. If you're always asking, we lack this, we want a CT scan maybe, for example, we want an X-ray machine. Lack of proper resources or equipment can lead to delays, and as a result of delays, there's increased workload and resulting in reduction in productivity. So we'll always look at this place is not good. The employees are not motivated. There's always low productivity. So because of lack of proper resources can lead to unprofessional work culture or mental health or stresses at the workplace. Also, our working environment and conditions. You can imagine working in a place where it's very noisy, too much light, very dangerous, irregular work hours, or excessive working hours, they're not balancing. It can lead to burnout. And burnout can lead to depression, stresses, anxiety, and other insomnia. We've also seen as some of the cases. So these are some of the risk factors to mental health. A summary of it is workload, excessive workload, insufficient work, poor interpersonal relationships, workplace culture, if it's a poor culture, a company culture, insufficient skills for the job, lack of proper resources or equipment, working environment that is poor, and poor working conditions, all are risks to mental health at the workplace. So as a result of this implication, what is the implication of mental health at the workplace? If mental health issues can have a negative impact on the organization's operation. And it can lead to a high staff turnover. You're hiring, firing. These employees, they go there 1 month, they're out. 2 months, 2 months, they're out. We can also have, ironically, presentism. A lot of people being there, presentism. I mean, you're there for so many days. Absenteeism, increased use of medical cover. People are always looking for solutions. They have headaches, they have stresses, they're depressed, stomach aches, wondering what is happening. All this just because of stresses. Poor timekeeping. They don't find a reason to be there on time. They're always making errors, and as a result, the customers are not satisfied, getting poor feedbacks. Disciplinary problems. This person is always not there. This person has this, is rude, is harassing somebody. So these are the implications of poor mental health issues that can have a negative impact. On the individual level, without effective support, mental disorders can affect a person's confidence. You're not confident, you don't feel good. It can affect your identity at your work, the capacity to work productively, and somebody can easily lose concentration and makes it difficult to multitask. You're supposed to do this and this. Someone who cannot do this and this at the same time. They have to just finish this, go to this, go to this. They cannot multitask or carry out the day-to-day activity. So they're losing concentration, and therefore they're not able to deliver on time, not able to deliver, they're always having deadlines, they're not able to achieve. So this is the implication of mental health at the workplace. So what actions, as a result of this, we've heard of the issues that are there, we've heard of what can cause unprofessional workplace culture. So as a result, what can we do? What are the actions to do? So as government, employers, the organizations which represent workers and employers and other stakeholders, they're responsible for workers' health and safety. And they can help to improve mental health at work through one of these. One, prevent work-related mental health conditions by preventing the risks to mental health at work. Prevention. So preventing the risks. Remember, we went through the risks. So preventing these risks at the workplace. Two, protect and promote mental health at the workplace. That this is a place where you feel good, your mental health is taken care of well at the workplace. You feel good and you feel supported. And support workers with mental health conditions. Because remember, 15% of the people working have at least one mental health condition. What are we doing for them? How are we supporting them? How are we incorporating them back to the workplace? So to be able to help them participate and thrive at the workplace, and create an enabling environment for change. Change is key. Remember, change should be there. And any other time, we should be not resistant to change. Let us accept change. So what are some of the actions? Now, Kenya Medical Association, which is helps to champion the welfare of doctors and quality healthcare in Kenya. On 10th October, as I said, which was a World Mental Health Day, they also celebrated it, and they encouraged the medics, there's the physician wellness, to encourage them, to support them, those who have mental illness, and to prevent mental illness. They assist that. So the theme of this year was, it is time to prioritize mental health in the workplace, as I had talked about it. So also Kenya Psychiatric Association, which is one of the institutions, there is an association for psychiatrists in Kenya. It also helps in assisting psychiatrists who have mental challenges, promoting wellness and the well-being of staff, of the psychiatrists in the institution. So the first picture was they were celebrating the Mental Health Day at the Mathare National Teaching and Referral Hospital. This is the team that is part of the KPA that supports mental health. So one of them is to prevent work-related mental health conditions by managing psychosocial risks in the workplace. We've talked about the risks, so managing them. For example, providing flexible working environment arrangements or implementing frameworks to deal with violence and harassment. How best do we prevent violence and harassment, or when it happens, like for example, sexual harassment? How do we deal with it? Does the employee feel it has been worked on? I'm shielded from harassment. I'm shielded from violence at my workplace. So one of them is to prevent work-related mental health conditions. Two is to protect and promote mental health at work. So one of the key things is, one, manager training for mental health. Remember, we have managers, we have leaders, that let us train them. Let us train head of departments, head of units, to be able to recognize and respond to those people who experience emotional distress, to be able to build interpersonal skills like open communication. Let us be, the leaders be approachable, that you're somebody who they can talk to, they feel good, they can approach you anytime they have issues. Practice active listening, and foster better on understanding how job stressors affect mental health. So we train managers. One of the key things is to train managers on mental health, how to recognize, how to prevent, how to actively listen, how to have active and open communication. Two, train workers, employees in mental health literacy and awareness. Try and encourage and train them that this is mental health. These are the signs and symptoms of mental health. This is how to reduce. This is symptoms and signs and symptoms of mental illness. This is how to reduce stigma, because we can have people with mental illness, but as employees, we don't know how to treat them. How are we supposed to talk to them? How are we supposed to mingle with them? So we're supposed to train workers to be able to reduce stigma against mental health conditions at the workplace. Also, have interventions for individuals to build skills to manage stress. Stress and stress management is a topic that can be discussed, and to reduce mental health symptoms, including psychosocial interventions and opportunities for leisure-based physical activity. Let us encourage employees and workers. What can we do to prevent mental health? Or if it is there, how best do we handle people who have issues with mental illness? So this is Kenyatta National Hospital. We were training the managers. As you can see, one of the key things 2A is manager training for mental health. So here we were training the head of units and head of departments on how to recognize, this was the discussion, how to recognize employees or people who have issues with depression and suicide. So we're trying to encourage them. This is what are the signs and symptoms to see. This is what you can do as a head of unit, as a leader. So this is it was a multidisciplinary team. We had the security team here. We had some consultants here. We had the consultant psychiatrists here. We had the patient affairs department here. We had the nursing team. We had chaplaincy. We have a chaplain in Kenyatta, and it encourages people to come and talk and air their issues. So this is a multidisciplinary team on how best to improve, and this is in charge of employee assistance program, because we have the employee assistance program in Kenyatta to encourage and listen to employees and how best to assist them to have mental well-being, to have mental well-being and resilience. So support people with mental health and conditions as the third one. People living with mental health conditions have a right to participate in work fully and fairly. Fully and fairly. That if I have a mental health condition, depression, bipolar, schizophrenia, insomnia, I should be able to work like the others. I should be able to be treated fairly. But how best can we also accommodate them? Let us have flexible working hours, extra time to complete tasks so that we are not rushing with deadlines, modified assignments to reduce stress, have time off for health appointments, that if somebody tells you or an employee tells you, I have an appointment with a psychiatrist, with a psychologist, with a doctor, have time for them, give them time off, because once they're treated and they feel much better, they'll be able to perform fully. Have regular supportive meetings with supervisors. One-on-one, discuss with employees how are we doing? What can we do? Trying and accommodating people. Return to work programs. Like this is now, for example, re-entry to work. Patients who are employees who have had issues with mental illness. How do we have them back to the program? How do we assist them to prevent absenteeism? We also have supported employment initiatives that help people with severe mental health conditions to get into paid work and maintain their time on work through and continue to provide mental health and vocational support. So we are trying to encourage them that you are worthy, you are loved, even with mental health conditions, you are. It is, that thing of it is okay not to be okay. And for sure, it is okay not to be okay. At times you can just feel you're breaking down. But in that moment, let somebody hold your hand to reduce that stress, to encourage you to get back to the program, that you are worthy, we need you, you are precious to the department, you are precious to the institution. So create an enabling environment for change. Remember, there was an issue about change. People are resistant to change, but create an environment for change. Have a good leadership and commitment to mental health at work by integrating mental health at work into relevant policies. Investment, rights to participate in work, integration of mental health at work across sectors, that you embrace and incorporate mental health in different and existing systems for occupational safety and health. Another one is participation. Have workers participate in decision making. Let them have meaningful and timely consultations with workers, their representatives, and people with lived experience of mental health conditions. Let them participate fully. Evidence on psychosocial risks and effectiveness of interventions by ensuring that all guidance and action is based on latest evidence. This is evidence on this and this and this. Compliance with laws and regulations and recommendations by integrating this mental health into the responsibilities of national labor inspectorates and other compliance mechanisms. So in short, what this is we try and have and encourage, if there's something, and encourage them that it can be changed, incorporate decision-making, policies, mental health policies, laws and regulations, investments, rights, there's rights to workers. So try and encourage and make it a good and a professional work culture. So what employers or managers can do to create a safe working environment? One, identify and address factors that affect mental health at the workplace. If it is workloads, are you trying to reduce the workloads? If it is insufficient training, is it this that is affecting our employees or our co-workers? They're not able to perform well. So identify and address those factors. Raise awareness on what employees can do to look after their own and others' mental well-being. Remember, as a trainer, as a leader, you have been trained. So what are you going to do? One of the things is raising awareness. Also, recognize that all employees have mental health needs and provide support options, confidential and non-stigmatizing. You don't need to give examples that so-and-so, so-and-so is on treatment for depression, so-and-so is on treatment for this. No, let it be confidential, non-stigmatizing, and recognize those who have it and work with them, assist them. How best can I help you? Building a working culture where mental health issues are not a taboo. Remember, those are the days where we used to think mental health was kurogwa, was cast witchcraft. No, mental health is affecting you and me. So it is there with us. So let us see how best to have a good working culture. Review employment practices to ensure employees with mental problems are not excluded. Let us have them with us. Let us talk with them. Let us see how best to assist them. Support employees at risk by organizing their mental support services. If there are support services that are there, encourage and organize for them. And ensure that every employee is properly trained for their job. I have been trained for this. This is what I'm going to do. This is what I've been assigned to do, to avoid skill gap that can lead to low productivity. So what you're talking about in a nutshell is respect. In a respectful, caring, and responsible work environment, employees feel valued, communication is polite and courteous, people treat each other as they want to be treated, conflict is addressed in a positive and respectful manner, harassment and disrespectful behavior are not tolerated. So each and every employee feel they're valued, they're respected. Communication is polite. You're treating each other as how you want to be treated. You may not like someone or choose them as your friend, but it is your responsibility to figure out how to have a courteous and professional work relationship, because everyone deserves to be treated respectfully. Everyone, the key thing is everyone, whether they have mental illness or not, whether they have disabilities or not, everyone deserves to be treated respectfully at work. So strategies for a positive work environment: you understand other person's point of view, you accept values and opinions that are different from your own, agree to disagree, identify your own feelings before you share your concerns with another person. Do not blame, threaten, or name call, even if you're angry or hurt. Report harassment if you've been harassed or discriminated or abused. So these are strategies that you're looking for at how to make a work environment to be positive. So no matter what your line of work, your degree of success depends on your ability to interact effectively with other people. So the key thing is interacting effectively for a good professional work culture to reduce mental health at the workplace. So sometimes it is not what you say, but how you say it. We'll always remember how you told us. As a leader, we'll always remember how you communicated, but not what you said. Remember. So now, there could be also nonverbal communication. Remember, just sometimes there's verbal and nonverbal communication. And nonverbal could include the body language, tense, your arms are crossed, the emotion of the sender and receiver. Are they anxious? Are they angry? Similarities or differences between people. Is it a communication between a friend to friend, an adversary, an opponent? Look at the age, look at the profession. So these are some of the things to look for in nonverbal communication. And some of the barriers of effective communication, as much as we want to have a good effective communication, some of the barriers could be misreading body language, tone, and other nonverbal forms of communication. So don't misread somebody's body language. Selective hearing or distractions. You want to hear this or you don't want to hear this. Or you're always defensive. You're always assuming. You're always judgmental, stereotyping. Or cultural differences can make somebody can be a barrier to effective communication. Or stress can make people not have effective communication at a workplace. Others, barriers to active listening, mind reading, interrupting. You want to interrupt somebody who's talking, you filter, you rehearse. You want to rehearse what exactly you're going to say. Can be a barrier to active listening. So effective communication is maintain a positive and concerned attitude. Be aware of your audience. Use approachable language. Let's see what we can do. Not just always saying, no, no, let's do this, no, no. Use approachable, let's see, let me see what I can do. It's an approachable one. Be direct and specific. Allow me to take some water. Sorry about that. Utilize assertive communication skills. Assumes that I have the right to express myself and be heard. So do you, even if we do not agree. Talk about the actions, not the character. Take responsibility and use direct statements to express thoughts, feelings, and ideas. So assertive communication skills. Be direct and specific to what exactly you want to say. Don't go through corners. Be assertive. This is what I want. This is what I need. Express yourself. Words that promote conflict. Imagine as a leader, somebody telling you, you must do this and this. Huh? This is so typical of you. You're doing this and this. You're always late. You never come on time. The problem is you don't listen. If you don't do this, then I'll fire you. You'll never change. This is how you are. You're being hysterical. What's the matter with you? So these are words that promote conflict. Remember, you're trying to encourage effective communication. So avoid using such statements because it can puncture somebody. It can lead somebody to have a lot of stress, and you'll always feel like, I'm not loved, I'm not appreciated. So you're looking at things that have effective communication. So the iceberg of conflict. So what you'll see is just the issue. Remember, what you see at a workplace is just the issue, but underneath it, what are there? From here, from the ground, you can see the unresolved issues. This is the magnitude of it. You can have unresolved issues from the past. You're carrying things. You remember you did this and this. You did this and this 2 years ago. You have hidden expectations of what you want. There's self-perceptions and self-esteem affecting. interests, the needs and desires, the emotions, the personality of an individual. So all these are underlying thing. So on top, you're just seeing the issue, but there's an iceberg of this. So you're only seeing the top, but underneath the issue, there's so many things being covered up. So think about them. Yeah. Think of them for us to have effective communication at the workplace. So additional strategies, respect each other's boundaries. Remember the keyword was respect, but also respect other people's boundaries. Acknowledge and solve problems. Acknowledge the other person's needs. Listen patiently and repeat back what you think you heard. Use empathy. Ask questions that will provide you with information. Give each other the benefit of doubt and offer a choice of solutions. Acknowledging, listening to them, have empathy, ask questions that will assist you in providing information. Try to get along with difficult. Remember, difficult people are always there. Even as a leader, they will always say, there's this difficult person in my institution, and I just don't know what to do. Remember, difficult people often come into a situation with their own, remember difficult people often come into a situation with their own set of problems we are unaware of. They also have their own conflicts. They also have their own personalities. So you're not, remember, you cannot be aware of everything. So focus on the facts and not on the emotions. Try not to take it personally and focus on the whole person. Listen patiently. Let the person express himself. This is what I am doing. This is what I feel. Let them express themselves. Acknowledge their pain. Acknowledge their feelings. Ensure that you really heard and you understood. But remember, you clarify. Did you tell me you had this? I remember you have told me you wanted to take an off. Is that true? You know, remember they'll always be there, but try and hear them. They are also part of us and they need to be talked to. And remember, they might be going through things that you're not, maybe they have a baggage on their own. Remember, work-life balance, they have relationship issues, or maybe they're going through a lot of challenges, or maybe physical problems, medical illness. So try and get along with them. Balance family and work life. Remember, have a good work-life balance. Create a supportive network of co-workers and friends. Let us have a good relationship of co-workers and friends. So as an individual, what am I telling you? Do the right things and do them right as a leader or as an employee. Doing the best that you can do. I have done, this is the best I can ever do. Be internally driven, be innovative, be creative. Have a vision and a motto in your life. What do you want to be? What do you want to achieve? What is your vision? Where do you want to go in 2 years, in 5 years? Huh? What is this is an individual responsibility. And correcting situations when they are wrong. Be open to change and be open to say sorry when you've done something wrong. Correcting situations when you're wrong. Leave a signature in your organization. Let people feel that you are there. So meaning you do the right things at the right time, you be innovative, be creative, be focused, and at the end of the day, you leave a signature in your organization. So as a conclusion, workplace health promotion programs have proven to be successful, especially when they combine mental and physical health interventions. Workplace wellness programs can identify those at risk and connect them to treatment and put them in place to support to help people reduce and manage mental and emotional challenges. That these wellness programs that are being put in place that and identify somebody with mental illness. And if they have identified somebody, how do they help them? How do they get treatment? And if they are treated, are they incorporated back to the workplace? How are they treated fairly? That's what you're trying to say. So always have a good work. Let's introduce workplace wellness programs in our institutions. A professional workplace is enhanced if employees continually use effective strategies to actively listen, not only listening, but actively listening to one another and working together to resolve differences in a healthy way. So some of the questions that I want to ask, be it if you're working in an institution, if you're self-employed, or not self-employed, mostly in an institution or a department. Does your department or organization have identifiable values and attitudes? What aspects of your organizational culture are positive and ethical? Which are those that are undesirable? Does the culture of your department support the overall culture that is desirable? Do they support you? Do they encourage you? Do they clap for you when you've done well? Do they reward you? So, what is being done in your organization to create a positive culture? Are they training people with mental illness? Are they supporting each other? Do they incorporate a good work-life balance? And what methods have you put in place to pass key messages to your staff, to your clients, to your customers? What are the key messages that you've passed? You're there to serve you, you're always right, we listen, we care. What are the key messages that have you passed to your customers? So this is my last slide. That this was when the employee assistance program had been started during the pandemic in KNH, and the staff there were happy that KNH came through for employees. So I'll challenge each and every person to have an employee assistance program in every institution, to listen, to take care of our employees. Remember, this is where we spend most of our time. This is where we want to be happy. This is where I want to wake up and feel good, appreciated, effective communication, good leadership skills, and everything else. The employees in Kenyatta said, Asante KNH. And as Dr. Mashua, I say Asante everybody for listening to me. Thank you so much, and hope you've learned something. Thank you.
All right. Wow. Thank you so much, Dr. Irene. That was a very comprehensive presentation on the Nexus of mental health and work culture. It was really fantastic. All the questions I had, honestly, they were they were answered with time, and it was the first time seeing that iceberg of, I think, of solutions or problems. I I I forget the name, but that was the first time. It was everything that you said today is really it's eye-opening, and it's really the truth, and it really speaks a lot to the work culture that we have all experienced at one time. And for me, what stood out for me was the key areas of focus in order to improve mental health at the workplace. The leadership, personally, in the areas that in the workplaces that I've worked before, I really got to see how the way you explained how culture is not felt, is not seen, but you can actually see it in the way people move, how the little tiny behaviors of a culture, and actually how the leaders behave and things like that. And then it's passed down, it's transmitted to the employees, and it's almost palpable, but you can't see it. For me as well, there was about compensation practices. That is very fundamental, especially in right now where we in this uh, it's in this capitalistic and over consumeristic kind of environment where it promotes hustle culture, and most of our days are spent at work. It only makes sense that we improve mental health at the workplace. So I'll directly move to the Q&A section. I only see one question. I don't know if I had seen earlier two, but but unfortunately I was logged off and then I had to re-log in, so I can only see one question. But from what I remember, I think someone had asked for more information. You've spoken about the KNH Employee Assistance Program. Can you give us some more information on what kind of assistance actually that means, and what they do uh, for employees?
Okay. Thank you so much for the question. And if anyone in my midst as an employee from Kenyatta who can answer best, I'll be glad to take in. So the Employee Assistance Program had been started around the year COVID time, around 2020. That's when I picked. I just joined Kenyatta 1 year ago. And of all the places that I've worked, it's an institution that I'm proud of because the employee has a place to run to. That if you have an issue with the HR, with the patients, with the workplace, is a place where you can run to and somebody can listen to. At the place, there were two counselors, one just retired and another one is almost retiring. So they have two psychologists who are there to listen and talk to. And if there's a way they can assist, if it is treatment for mental illness, they bring them to the Department of Mental Health, where we see them. If it is an admission, we admit at the facility. If it is a referral, we refer where they're needed. And if it is an issue with workplace, we're able to have a letter or a document to the employer on how best the patient can be assisted or how best the worker can be assisted. Meaning we identify the problems. If it is time off, if it is a lighter duty that they need, if it is then they have a child who's sick and needs assistance or needs some time off to take care of the child, we discuss with the employer. So we are a link. It's an employee assistance program is a link between the management and the employees. So it's in a way of and trying to listen to them, to the employees. What are your issues? How best can we assist you in terms of wellness, in terms of welfare issues? So they have psychologists who are there to also offer psychological first aid whenever they need help. So I don't know if I was able to answer you.
I think that is a fair enough answer. And what is the uptick of the employee assistance programs? Do you see which cadre mostly uptick the assistance? Because we know that doctors sometimes can be poor in seeking help, and that is a question from one of our anonymous attendees. Yes, specifically about that KNH employee assistance program.
Okay, the ones that I've interacted with, mostly in KNH, we have 5,000 employees, over 5,000. And you see, that's a big number. And most of the people that I see are nurses because they form a bigger percentage of the employees. So we've seen them the one who take up the program. They're the ones who are seen mostly with the employee assistance program, but generally it is open to each and every person. But yes, I agree. The doctors, we want to hide and say we are okay. But the beauty about it is okay not to be okay. That if we have an issue, let us come out and discuss. If even the surgeons, even the neurosurgeons go through a lot, the orthopedic surgeons, the neurologists, the cook, the chefs, each and every person goes through a lot. So it is open for each and every individual, but because of the numbers, the nurses are more, so they're also seen more. We've seen cases, and even alcohol use disorder is most common. So if a client or a worker has alcohol use disorder, they assist them to be taken to a rehabilitation center and come back and recuperated back to the workplace and give a report to the management so that they're able to be understood that this is a condition, it is a mental health condition, they can be understood and they can be encouraged.
Fantastic. All right, so I'll take more questions from the Q&A section. An individual asks, how do you deal with an employer who disregards employees' mental health and promotes a toxic and highly stressful work environment? This is a precarious situation, especially when you join a workplace and you know all these things are, you're trying to balance staying at this workplace. You don't want to lose your job, but you can see evidently that everything is going downhill. Secretary, what do you propose we do there?
Okay. Yeah, for sure. Some places, some people just report and they just feel it is very toxic. But what I can say is, as an individual, there's an individual responsibility. And I think it had come out that as an individual, what can you do? What can you do on your end to ensure that people are there? Because remember, people have resistance to change. They do not want, this is how we have done our things. You have found us doing this. You have found us coming to our workplace from 8 to 6 or from 8 to 4. We are resistant to change. So as an individual, there's something called effective communication. Let us have communication to the leaders. How best can we work it out? Lead from the front. Don't just come and say, because I found it like this, I will leave it like this. No, be the change that an institution wants you to be. Be that change that they can say, I have left a mark for sure in this institution, that if I leave this place 5 years down the line, they'll remember that I brought this change. that we were there for one another. Introduce a place where people feel good, a good work-life balance. Encourage colleagues to go for, team building. You can just have your own. Some things can be changed, others cannot. But what you can do on your end, now do it. That's what I'm trying to say. If you're a leader in that institution, be a leader that is approachable, that people can run to you, that your words are kind, you're courteous to people. That I feel like if I go to so and so, maybe if I go to Dr. Mashua, I feel like I have been heard. I feel like she has heard my issues. I feel like it has been solved. So be that leader with actively listening. That's what you're trying to say. Be an active listener. Try and encourage those people who have mental illness. The people who have mental illness, and maybe they have other issues that they're going through, and you might not be able to understand them. The difficult people, remember they're difficult people. And you're trying to wonder, why is this person always difficult? I've tried this, I've tried this. Maybe there are challenges they're going through. Understand them. Listen to them. Let them also share their views. Don't always say, no, no, no. Find a way of saying, what can we do? How do you want it out? And be open to change. There's something called culture change. In Kenyatta, when I came in, they'd introduced something called culture change, that it had been an institution where I found it like this. So as an individual, we were encouraged, what can you do for that institution? Introduce a change where myself, what value am I adding to this institution? And be proud of anything that you do in an institution. That's what we're trying to talk it out. Thank you. Daktari?
All right. Yes, I'm here. All right then. So someone else has asked, is it a sign of mental illness if you cannot multitask?
Yeah, they say men cannot multitask. I don't know if it's, are they all, do they have all mental illness? No, sometimes, huh? So sometimes some people are not able to multitask. It is part of them. They know they can do this at this time and then finish and accomplish this other time. And some people have ADHD. ADHD is common and most people have not known about it. ADHD is also there. People have inattention issues. And we also encourage them and we try and nurture what they can do best at the right time. So multitasking is not an issue of mental illness. There are people who cannot actually just multitask. And the ladies are so good in multitasking, you'll wonder how they did it at the same time. So it is not an issue. It's not a sign and symptom of mental illness.
Okay, all right. So Muritu, to end this session, we'll take one more question from Muritu, who was asked in the chat section. He's asked how can the employee assistance program policy development be fast-tracked at Athia House MOH, and if we could have a timeline. And he referenced the recent death from of a junior doctor who was an intern at Gatondo level 5 hospital.
Okay, one, the Ministry of Health, as I had said, and let me share it. The Ministry of Health in 2023, they released the mental health. Let me get it right. The mental health at the workplace. Here's that document. Where's document? This document, National Guidelines on Workplace Mental Wellness. This is a book that was developed as a result of so many cases of illnesses or reduction of productivity at the workplace, and they really needed to know how best to assist. So with the Ministry of Health, under the guidance of the mental health department, they released this last year. So it is 1 year old. And they gave a guidelines on how to work it out and roll it out in institutions. Like the institutions like Mathare National Teaching and Referral Hospital, who are beginning the wellness program. So it is a guideline on what they can do as a leader, as an individual, as a colleague. If you see somebody with mental illness, how do you assist them? Because some people, you might see rising cases of suicide, and we put a blame on something, yet maybe they have other challenges going through. So what we'll see on the forefront is the issue, but we're supposed to know the other issues that could be going through. Maybe they're going through financial challenges, emotional breakdown, relationship issues, breakups, mental illnesses. Some people could be actually having mental illnesses. And so that is a guideline in a way that if we identify them, how do we help them out? Like now, Ministry of Health, it was a national guideline for each and every institution. So like now, maybe an institution like Madare, an institution like Gatundu, Thika, Kiambu, they're now rolling out to the employees. How do you work it out? Let us have an employee assistance program with a counselor in charge that employees can walk to, can talk to, and can be referred and discuss if they have any issues, like a link between the management and the employees. So this is a guideline for how to roll it out.
Okay, all right then. So thank you everyone for sparing a few minutes of your evening to join us for this webinar. And thank you, Dr. Irene, for that comprehensive presentation. I think every one of us has learned something or has had something reiterated to them this evening. And I'll actually, personally, I'm going to go and look at the national guidelines on workplace mental wellness. And I encourage each and every one of you to do the same. So without further much to do or to say, I would like to announce that it's the end of the webinar, and look forward to seeing you again for the next webinar. Should be next Wednesday, using the same platform, Zoom. So look forward to the links for the invitation and set your calendar reminders for the next webinar. Thank you very much. Have a fantastic evening, everyone. Be free
Thank
to
you
leave
so
at your
much.
own pleasure.
Enjoy your evening. Thank you.
Yeah.
Bye.
Bye. Good night.
Good night. Thank you.